You start exercising more. You feel proud. And then a headache shows up, like a bill you did not expect. That can be confusing, because exercise is supposed to help your health, not punish you for it. Most of the time, this kind of headache is not a mystery disease. It is your body reacting to a change in load. More intensity, more heat, more breathing, more muscle tension, and sometimes less fluid and fuel than you think. Here's the practical question you actually care about. Is this a normal adjustment you can fix with small changes, or a red flag that needs medical attention? We are going to build a simple mental checklist. First, the common causes like dehydration, low blood sugar, and breathing patterns. Then we will cover technique issues like neck and jaw tension. After that, environmental triggers like heat and altitude. And finally, the warning signs that should not be ignored. By the end, you should be able to point to the most likely cause in your routine within a week of workouts, not months of guessing. Moving to slide 2. Let's separate two categories because it changes how you respond. First category is a primary exercise headache. That is a headache triggered by exertion itself. It often feels like a throbbing pressure on both sides of the head. It can happen during intense effort or right after. Many cases are benign, but the first time it happens, especially if it is sudden and severe, it deserves caution. Second category is an exercise-associated headache, meaning exercise is not the root cause. It is just the moment that exposes something else. Dehydration, skipped meals, poor sleep, caffeine timing, tight neck muscles, even sinus issues. This distinction matters because the fix is different. If exertion is the trigger, you often adjust intensity, warm-up, and breathing. If the headache is associated, you look at inputs around the workout. So when you think back to your last few sessions, ask 2 quick questions. Did it start only when you pushed hard, or did it build gradually with the day, and exercise just finished the job? Moving to slide 3. One of the most common reasons headaches show up after you increase training is simple. You are losing more fluid than your habits are replacing. When you sweat, you lose water and electrolytes. That can reduce blood volume a bit. Your heart works harder to push blood around, and your brain is sensitive to changes in hydration and circulation. Headache can be one of the first signals. A tricky part is that thirst is late. You can be mildly dehydrated and not feel thirsty yet. Another trap is thinking one big bottle after the workout fixes everything. If you start the session already behind, you are playing catch-up. Also, it is not only water. If you sweat a lot, sodium loss matters. Low sodium relative to fluid can contribute to headache and that washed-out feeling. A practical check. If your urine is consistently very dark, if your body weight drops a lot from pre to post-workout, or if you get a headache mostly on hot days, hydration and electrolytes jump up the list. Moving to slide 4. Another classic trigger is underfueling. When you exercise more, you burn more carbohydrate. Your brain also relies heavily on glucose. If your pre-workout meal is too small, too far away, or you are training fasted without adapting, you can dip low enough to feel it. A low-fuel headache often comes with other clues. You feel shaky or irritable. Your effort feels harder than it should. You might get lightheaded when you stop moving. Some people also notice nausea. This is not about eating huge meals. It is about timing and consistency. If you are adding extra sessions, your normal eating pattern might not match the new demand. Caffeine can complicate this. If you use caffeine to push through a session while underfueled, you may get a double hit: stimulation plus low energy availability. That can feel like a tight, buzzing headache afterward. If your headaches happen most when you train early, skip breakfast, or go long without a snack, fuel becomes a prime suspect. Moving to slide 5. Breathing sounds too basic to cause headaches, but it does, especially when you start training harder. If you hold your breath during effort, like during heavy lifts, or even steep hills, you create a big pressure change in your chest and head. That is similar to the Valsalva maneuver. It can spike blood pressure briefly. For some people, that pressure sensation becomes a headache. On the other side, you can overbreathe. Fast, shallow breathing can drop carbon dioxide too low.
Carbon dioxide helps regulate blood vessel tone in the brain. When it drops, vessels can constrict and that can trigger lightheadedness and headache. So the pattern matters. Do you clench and hold your breath on reps? Or do you pant and feel tingly fingers?
Those are different problems. A simple adjustment is learning a steady exhale during effort and a controlled inhale on the easier phase. Not perfect yoga breathing. Just consistent, not panicked, not held. Moving to slide 6. If your headache feels like it starts at the base of the skull, behind the eyes, or on one side near the temple, look at tension. Not just stress tension, mechanical tension. When you run, cycle, row, or lift, it is easy to creep into a forward head posture. Chin juts forward, shoulders rise, neck muscles work overtime to stabilize your head. Add fatigue, and you start bracing without noticing. Jaw clenching is another sneaky one. Hard efforts make people bite down. That loads the temporalis and masseter muscles. The pain can refer into the temples and feel like a classic headache. And then there is the upper back. If your thoracic spine is stiff, your neck often compensates. So the neck is not always the root cause. It is the victim. A quick self-check after training. Are your shoulders up near your ears? Do you notice tooth marks on your tongue? Do you feel a tight band across the forehead? Those are tension fingerprints. Moving to slide 7. Sometimes the headache is not from your muscles or hydration. It is from your eyes and your nervous system working harder than you realize. If you start running outside more, you may be squinting in bright light. Squinting recruits muscles around the eyes and forehead. Over time, that can feel like a pressure headache. If you start cycling or lifting with a new setup, your gaze can change too. Looking slightly up for long periods, like on a bike or during certain machines, can load the neck and eye muscles together. And motion matters. Repetitive bouncing, like running, can irritate people who are prone to migraine. Not because running is bad, but because the nervous system is sensitive to rhythm, heat, and exertion all at once. If your headache comes with light sensitivity, visual disturbances, or nausea, that leans more migraine-like. It does not automatically mean danger, but it does mean your triggers and recovery habits matter more. Moving to slide 8. Heat is a multiplier. It makes almost every headache trigger more likely. When you train in warm conditions, you sweat more and lose more fluid and sodium. Your body also sends more blood to the skin to cool you down. That can change circulation dynamics and make your heart rate climb at the same pace. Heat also raises perceived effort, so you might unintentionally push harder than planned. Or you might breathe faster and shallower. Both can feed into headache. Altitude is another environment factor. At higher elevation, oxygen is lower. Your breathing increases. Your blood vessels can dilate. Headache is a common early symptom for people who are not acclimated. Even indoor environments can matter. Poor ventilation, strong odors, or dry air can irritate sinuses and trigger headache during cardio. If your headaches cluster around hot days, stuffy gyms, or travel to higher elevations, the environment is not background noise. Moving to slide 9. If the headache hits during lifting, especially heavy sets, pay attention to technique and bracing. Heavy resistance work often involves high effort and short breath holds. That can raise pressure quickly. Combine that with a tight neck, and the head becomes part of the brace. People will shrug, crane the neck, and grind through reps. Another factor is the warm-up. If you jump from cold to maximal effort, your blood pressure response is sharper. A gradual ramp-up gives your body time to adapt. Also check your rest times. If you are rushing sets, your breathing stays elevated. Carbon dioxide can swing around. That can contribute to a pounding feeling. And then there is form under fatigue. When your core gives out, you compensate with your neck and jaw. That is when headaches appear after the session, not during. If your headaches are tied to deadlifts, squats, or overhead pressing, the fix is often boring. Better warm-up, better breathing, slightly less intensity for a few weeks. Moving to slide 10. Cardio has its own headache patterns, especially when you increase volume quickly. With running, impact and heat are common, but pacing is the big one.
Many people accidentally turn easy runs into medium-hard runs. You can still finish, but your body pays for it later with a pounding head. With cycling, posture is huge. A low handlebar position can tilt your head up for long periods. That loads the suboccipital muscles at the base of the skull. Add wind, squinting, and dehydration, and headaches become predictable. With rowing, it is often neck tension and breath timing. People rush the stroke, hold the breath, and shrug.
There is also something called delayed onset headache. Not muscle soreness, but a headache that appears hours after a long session because you under-recovered. Poor sleep, low food intake, and dehydration stack up. If cardio headaches show up, try one change at a time. Slow the pace, shorten the session, or add a longer warm-up. Moving to slide 11. Headaches after you exercise more can also come from what you do outside the gym. The boring stuff. Sleep is a big one. When you increase training, you need more recovery. If sleep stays the same or gets worse, your nervous system becomes more reactive. Pain thresholds drop. Headaches become easier to trigger. Stress works similarly. Hard training is stress, even if it is positive. Work stress plus training stress can push you into a state where your body stays tense all day. Then one workout is enough to tip you into a headache. Caffeine timing is another. If you increase caffeine to match training, you might get rebound headaches when it wears off. Or you might train with less sleep and more caffeine, which can feel like a wired headache. And do not ignore screen time and posture. If your neck is already irritated from hours at a laptop, adding training on top can be the final straw. If your training plan changed but your life did not adjust with it, headaches can be your early warning signal. Moving to slide 12. Now let's talk about the stuff you should not brush off. Most exercise-related headaches are manageable, but a few patterns deserve medical attention. If you get a sudden, severe headache that peaks fast, especially during exertion, treat that as a red flag. If it is the worst headache of your life, do not try to tough it out. Also, pay attention to neurological symptoms. Weakness, numbness, confusion, fainting, trouble speaking, or vision loss are not normal workout side effects. A headache with chest pain, severe shortness of breath, or a racing irregular heartbeat is another reason to stop and get checked. And if headaches are new for you and keep recurring with exercise, or they are getting progressively worse, that is a reason to talk to a clinician. Sometimes exertion headaches can overlap with blood pressure issues, sinus disease, or migraine disorders. The goal is not to scare you. It is to give you a clean line. Most headaches are fixable. Moving to slide 13. Let's turn all of this into a quick troubleshooting plan you can actually follow. Step 1 is timing. Does the headache start during the hardest minutes or after you stop? During hard effort points toward pressure and breathing. Afterward points more toward dehydration, fuel, heat, and tension. Step 2 is location and feel. Throbbing on both sides with exertion suggests pressure changes. A tight band across the forehead suggests tension and jaw clenching. Pain at the base of the skull suggests neck posture.
Step 3 is context. Hot day, long session, poor sleep, skipped meal, new pre-workout caffeine habit, new bike fit.
Any one of those can be the missing piece. Step 4 is change one variable for 3 sessions, not 10 changes at once. For example, add a longer warm-up, or slow the pace, or bring fluids and electrolytes. If the headache improves, you found your lever. If it does not, you keep the same baseline and test the next variable. Moving to slide 14. Let's close with a realistic way to reduce the odds of headaches when you ramp up training. First, progress gradually. Your fitness adapts, but your tendons, neck stabilizers, and nervous system also need time. Big jumps in intensity are a common trigger. Second, warm up like you mean it. A few easy minutes is not wasted time. It smooths breathing, circulation, and pressure responses. Third, treat hydration and sodium as part of training, not an afterthought, especially in heat or long sessions. Fourth, respect fueling. If you are adding volume, your baseline meals might need to shift earlier or become more consistent. Fifth, relax your face. That sounds silly, but it works. Unclench the jaw. Drop the shoulders. Exhale through hard parts. If you want, leave a comment with your pattern. Do your headaches show up more with lifting or cardio? And if this was useful, subscribe for more practical training science that stays grounded. This information is not a substitute for medical advice. Upgrade the system. Extend the lifespan.